being au pair. It's like a nanny overseas. So like you nanny like you live in family, you live in their home, and then you pay like just a little bit per week, and you take care of the kids, and then you have weekends to but
I prefer it's like the thinnest but provides more.
Okay. How's your morning? Good. The sunshine today, right? A little bit cold. The sunshine. Okay, let's start. when you sit in meditation, you feel your heartbeat. Good. If you could feel, that means you are much calmer. If you could not feel that, you need more times to practice. Okay. All right. So let's just move on for this class. Today we talk about mindfulness, hospice, or elderly care. All of us will be older one day, right? And how many of you, any one of you, has family members in nursing home? Your more who is it? Is your
My great grandma.
oh really? How old is he or she?
She.
How old is she?
She 86.
86. She's still okay?
She's had a lot of medical problems recently, like more so than usual. So it's kind of like not as good as it could be right now.
Sometimes you visit her. Anyone of you?
My grandpa's not a nursing home, but he lives with my uncle. He's 90. He's in good shape.
Okay. We will talk about that. Okay, yeah, Tina, you like to start number one? Yeah, please.
I couldn't get mine to upload, by the way. I don't know if anybody else had a problem. There wasn't a submit button on the assignment.
Oh, really?
So I couldn't submit mine. I'll have to submit it after class, but I don't know if anyone
Some of you can submit, right? Yeah.
I guess it was just me then. But mine didn't have a submit button, so
Oh, really?
I didn't know if that was a setting or
Otherwise.
something, but it must have just been a glitch. So
Okay.
anyway, I had to make my own little notes because I couldn't
Sure.
open it.
Oh,
It's
sure,
not
sure.
online.
Sure.
But I just compiled stuff from several of the different sources. One of the PowerPoints, I don't have the name of it right now, but listed some really good symptoms or like problems that people have. Probably the most recognizable is just emotional or mental exhaustion because it's really hard to care for someone that you love and see them in pain or not being able to take care of themselves because you feel empathy for them. You know, if you were in their place and you wouldn't be able to walk on your own or feed yourself, that it would be really difficult. And then it said that a lot of people experience grief even before the person passes away because they are grieving for that relationship loss, because sometimes, especially with people that have dementia or Alzheimer's, it's hard to have a relationship with them still because they might not remember you, or they might be just talking about random weird stuff, and it can be confusing, and then it can make you lose relationships with other people in your life as well because you're so busy taking care of this person, and sometimes you have to work on top of that or go to school or whatever, then you don't have very much time to spend on other people. And then a lot of times people stop taking care of themselves as well because they get so worried about this other person that they, stop exercising and stop, eating right and sleeping. They're having problems with their health because they're like forgetting themselves, and it's just because they're pouring so much into taking care of this other person. They're being really selfless, but it's actually hurting them. And then some of the benefits of being mindful and being aware while you're taking care of someone. I thought a really interesting one that I had never thought of was a lot of times if someone that you're taking care of is going to pass away, you don't really know what to say to them. And being mindful can help you weed out the things that are unimportant and the things that are important to say, because obviously your time is limited, and a lot of times what you say to them is not even for them, it's mainly for you. Like, you're trying to have closure, so you need to know the right words to say that are going to make you feel like you got it all in. You said everything that you need to say, and you're going to have closure after they pass on, that they knew everything you wanted them to know. And other benefits, being more mindful, you can manage your time more wisely. So the time that you do have in there taking care of them, they're going to get the best possible care. They're going to have the most time with you because you manage your time elsewhere, you manage your time there, you're not just dabbling around. And it'll help your relationships with other people then, because you'll be able to explain to them your feelings. You'll be able to accept how you feel and not fight it off. And non-judgment, I think that would be really important as well, because if you start judging the situation as just negative, 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 that's how you're going to feel all the time. You won't be able to accept your negative feelings, and then you're going to start being really depressed, and it's hard to take care of someone who's passing away if you're really depressed.
So what are the real cause that if we care for them without any kind of awareness, any kind of mindfulness, what are the real ones? What are the
Cost, your own health is a cost.
Your own health?
Your emotional and mental health as well as physical health.
How affect to the one that you care for?
Cost for them would be that they may not get as good of care as they could have because you're having problems taking care of them when you can't get your mind right.
Anyone of you here ever care for elderly people?
Yeah.
Is it burden for you or what?
I mean, yes and no. I think you have to approach it with, like you said, you have to keep yourself in mind. But yeah, I think it's definitely can't be if you're doing it constantly all the time.
How about others?
I used to volunteer at a nursing home.
Okay.
It wasn't an actual job. I didn't pay or anything. I just organized a lot of activities and things. That's my aunt was human resources director there, and I was in probably I think 8th and 9th grade when I did that. So I was pretty young then, so it was kind of hard for me at first. When I would go in there and see them, so I had to learn pretty young that a lot of these people, they might not be here the next time to come do an activity with them and things like that.
When you volunteer to work at the nursing home or even you're a nurse, so forth, it may be not much burnout for you if they are your family members, right? So in this article, the cause of care without awareness. You know what's mean compassion fetish? You know what's mean? What's mean?
Fatigue. Compassion fatigue.
What's mean?
It means that you've been caring so much that you just get
so
burnt out
tired,
and you just get too exhausted.
They're burnout too, emotional exhaustion, deforestation, impact on professional efficacy. As among have seen many people, they burn out, physically, mentally, emotionally too, because they have to take care of their children, their families, their job, and so forth. And on the top of that, they have to take care of the parents or grandparents. Unless they love them so much, otherwise, there's possibility that they would put them in nursing home. And I know as one lady, she loved her mom too much that during the last 6 months of her mom's life, she almost quit her jobs to stay home with her. But it's burden. And plus on the top of that, her husband is not handicapped, but he could not drive to work because of heart attack. So every day, she drove her husband to work, her son to school, and go back to take care of her mom. And so the last 6 months of her mom's life, she almost quit her job. But fortunately, the hospital, they understood her situations. And many people, they somehow they feel release when the parents or grandparents pass away because of that kind of burden. I could have the kind of feeling because I talk with many people. Plus, I don't, in our Asian traditions, we refer the parents or grandparents to stay with us. Some Asian families send their parents or grandparents to the nursing home, but up to now, that percentage I think about 10 or 20%. Most of the time they stay back. So the reason why sometimes it's burden for them too. Okay. So again, like depend upon your state of mind too, right? If you love them, it won't be burden. This is probably the last chance for you to contribute, for you to repay their kindness, for you to share your love with them, show your dedication to them. So it depends upon your state of mind. With mindfulness, we see. We'll talk the next one. Yeah. Yes.
Sorry, I know I wasn't here Monday, but I also chose number 1 too.
Oh, okay.
I have
Please
some
go
stuff
ahead.
to add, if that's okay.
Yeah, please.
I read something different. I read The Art of Presence, an exploration of mindfulness and aging, and it was really interesting because the author said that in this country or in this culture in particular, we have like a really sort of death-denying attitude to begin with. Like we have a really strong aversion towards thinking about death, which I think is, it's partially human nature, but she mentioned all of the anti-aging medicines and treatments and procedures we sort of become obsessed with to like maintain our looks or our lifestyles or something like that. So she kind of said that in doing that, we're not really we're not being aware of what is actually happening. So we're setting ourselves up for the suffering of when the aging really does set on because we've tried so hard to hang on to something else. So she actually said that if possible, you can teach mindfulness or meditation to elders, or if it's possible, I know sometimes it isn't, but if you are able to impart that knowledge on them, the article mentioned that their chronic pain is typically reduced because they approach their pain with like a non-judgmental. They let go of like the self-defeating thoughts about pain, so the psychological aspect of it kind of goes away. So I think it's interesting that the caregiver can practice mindfulness, but also, if possible, the client or the patient, you can always try to help them with it too, because we have such a strong negativity towards death.
Yeah, we talk about the other items too. Yeah. How many of you accept that soon later you won't be here? How many of you accept that reality? Okay. Sometimes it's hard for people to accept, right? But this is the reality, right? And on the process, all right, we're getting older, right? We'll be younger. So this process of life, and in Buddhist views, it's normal. But somehow in the West it's different, right? Somehow, especially the elderly people, somehow they, I don't know, like you say, they may be pushed aside, society. And of course, I know there's some activities for the elders, right? What they call, they have some kind of what they call continuing education or a field trip or whichever for the elders.
Community centers do a lot of things. My grandma's 90 and she goes to the community center like 2 or 3 times a week. And she eats meals there, and they have like workout sessions and they have like hiking.
Yeah, just keep their mind, have fun. Like one gentleman, he came last night. He's 72. He said that sometime almost every day he goes to what they call the community center to play cards and so forth. Sometimes he says it's so boring. not much activity. So that's the reason why he he come down monastery to do meditation with us. And sometimes he spend time with his young children, grandchildren, the younger one, not the older one. The younger one, he has more chance. The older ones, they're so busy with their own life. And now it's just like we have somehow, I could not, even in our Vietnamese Asian communities, we see that kind of disconnection between the younger generation and older one. But traditionally in Vietnam somehow that's just connected, because the parents and the parents live together, and in the Oriental or Eastern tradition we say that the older people are the wise they are. Well, they have more wisdom. That's why the younger need to respect the elder. But here is quite different. You see, so that somehow.
Great, it's very different here. I always thought it was so weird growing up. Some of my friends would not respect their parents or their grandparents at all. Like they talk back to them, and I was like, "Why are you doing that? Don't talk to your parents that way." And they would just laugh at me. But I've always been taught you always respect people older than you if you know them or not, but especially your family. And I still have friends. We're in college now, and they still treat their parents awful. I think that a lot of Americans are like that. They just don't have any respect for people older than them. Or, oh, my parents just don't know anything, but I guess they do. I think mine do. I think my grandparents are really smart and wise and compassionate, and a lot different than our generation. That's for sure.
Okay. So probably most of you grow up with this kind of traditional way, right? You were taught to respect the elder one, is that right? But somehow it's changing. So depend, and it will be our turn. Let me tell a story, and after that we move on. This what called the parable. Is one man. He has he make a box. I don't know whether you read that story or not. He made a box and put his elderly father inside and carry to the cliff, so that he could push out. And before he pushed down that box, so his father stepped out and said, "Don't worry, I can jump down to the cliff and save the box for yourself." For your children to push you. And after he heard that, wow, he recognized us and he took him back. And in our Asian tradition, it's a similar way. There's one man. He make the cart. In the old days, they made the carts, and he and his son, his little son, he said, "What's doing that? What are you doing there? What's you doing with this cart?" He said, "Well, I will push your grandpa to the forest." And he said, "Okay, can you make me one?" And so the father turned up, "Why you need that?" "So that when you get older, I will push you back to the forest too." So the consequence there, right? So that's a big lesson for us when we treat our parents or grandparents in a compassionate way, in a lovely way, or and so forth. We will set the model for our children and grandchildren. So that's the model. Okay, let's just move on. Number 2. Yes, please. What do you have? Number 2, please.
For number 2, what I found, it talked a lot about at first it talked about what causes more and more dementia, which is modern medicine just keeps getting better, so we live longer, but our minds haven't really evolved to sustain that age yet, so they just kind of fall apart at a certain age. And then when that happens, our loved ones have to put us in care, in hospice care, and then that's just a huge strain on them, and it causes something called caregiver syndrome, which most people don't realize they have, and they just get really stressed, and it can cause like heart problems and it said the best treatment for caregiver syndrome is meditation, which wasn't really surprising. MBSR is a huge help to caregivers because it helps them to be more mindful. And let's see. So there are 36 million people in the world with dementia, but by 2030, that will double and triple by 2050. I guess because modern medicine keeps advancing. It didn't really expand on that, but by participating in MBSR or any program that develops mindfulness, caregivers of dementia patients can ease their self-perceived burden of care and live a happier and less stress-filled life. It helps to lower their blood pressure, increase telomerase activity, which are linked to lifespan, and it'll lower their physical pain as well.
So can you some briefly the definition of dementia? What's it mean?
Dementia?
What's its meaning first, please?
It's just dementia is a broad term that encompasses a few illnesses, with the most common being Alzheimer's.
Yeah. This is feel hard, right? When one of our family members lost a memory, they may not know what they're talking about. They may not remember anything, right? And you may take care of them like a baby. It's feel hard. Taking care of the baby is different, right? You can carry them, but the other one is heavy. And plus, it's a lot of stresses. And I know the man. His mom fell down and had some kind of she has a stroke, and somehow she's almost paralyzed. And he's the youngest one in the families, but he's still single. That's the reason why he took care of her for more than 8 years. And even he's single, but it's heavy. It's heavy. It's just real burden for him, because he works full time and come back to take care of his mom. And sometimes he lives in California. So, sometimes he keep at cheap or some kind of snack, or the unhealthy food. Now when his mom passed away, he's so exhausted. It's all kind of illness in his body. So of course he loved his mom so much that he could care of her. Otherwise, like you mentioned recently, many people they may left the parents stay in the nursing home. And I know this one lady, at that time she was about, I think, above 70s, but she needed to take care of her mom who was above 90s. This is very stressful for her. And sometimes her mom stepped out from the bed, and she fell, and eventually, even she didn't want sending her mom to the nursing home, but there's no choice because it's so much stress, so much work for her, and it's not easy. Yeah. Okay, let's move on. Number 3. Yeah, please. Oh, wait, sorry. Let me before we move number 3. Let me show you this one, like the thing that degeneration. Let me see here.
Mindfulness is the one where I got.
Oh, the one you?
Yeah, it's the one.
Oh, good. Yeah, this is especially for the family members. This is this burden. Yeah, chronic stress, physical, mental, right? Depression, anxiety, poor quality of life. So this is here. Physical health, poor levels of perceived health, better numbers of physical symptoms and so forth. This is somehow, I can sorry, I blocked your views. Somehow it's not easy. It's the burden for the caregiver. Okay. All right. So the next one, please.
Okay. Okay. I guess overall, the study I read, it said that taking care of children with chronic conditions can lead to the caregiver experiencing obviously stress and mood disturbance. I wasn't exactly sure what mood disturbance meant. I ended up like Googling it, and all I got was mood disorder, which I think is kind of related with depression. I don't know if do you have kind of a like definition of what mood disturbance is?
Listen.
Mood disturbance, they called it.
And it's your mood just going up and down.
Like fluctuating? Okay.
Just are using a technical term for moodiness?
Maybe, okay.
That's
Anyways. So anyways, the study, stated that by participating in this 8-week MBSR program, the caregivers experience a decrease in this mood disturbance and stress. So I guess I kind of focus on now, like, how exactly did that happen? I think one of the reasons that happened is because the group setting at MBSR, it allows people to, talk with others who are having the same problems. However, that's not really strictly for MBSR. I think that can be kind of, with any group therapy, you could always obviously get those results. So more specifically, I guess, one of the things they introduced to the caregivers was things such as body scanning and mindful walking, mindful eating. All these things are, I guess, kind of a way to just, at least the way I view it, it may not be correct, but kind of a way to distract yourself from the stress that you are constantly feeling, by being able to, say, in body scanning, pay attention to, your body and how it feels. You aren't going to be thinking about, what you have to do really, coming up this day or the things you have to do all this week. So those were the main things that I guess MBSR taught them to help them deal with this. And I guess that's all I had. It seems like I had more, but I can't really think of it.
Yeah, thank you. For the children or even the elderly people with chronic conditions, like if they're handicapped, right? This is really burden too, right? And when you have that kind of experience, yes.
Oh, I haven't, but my older sister, who's now 29, when she was 3 years old, she had a stroke and her left side was paralyzed. I mean, like her left arm is paralyzed from here down. She's had surgery, so she can walk with her left leg, but she kind of limps because it kind of affected the alignment and her ability to use it correctly. And I think it affected part of her brain, but she's still capable. She's has a master's degree, which is fine. But my parents, that was it was a lot for them. And then growing up just with a sister who couldn't use her left arm, I was constantly lot of complicated things that, you know, she hadn't completely figured out how to do. Like recently, she's like, I figured out how to do the hairstyle. So.
Yeah.
I have a brother with autism, and so he can't talk or like he's capable of doing things on his own, but it's kind of he wouldn't be able to take care of himself on his own. And I don't think when he was born, my mom was not ready for that. She didn't handle it very well. It's a big thing. So my brother lives in Bloomington in a group home, and I was pretty young when this happened. Like I took care of him a lot when I was younger, and I had a lot of mixed feelings because I couldn't figure out why she was sending him away when I was the one taking care of him. You know, it was kind of thing. But then I realized I was only in like 6th grade. Like I needed to do school. I needed to do all this other stuff, and she was actually like responsible for him. So it's different. But he wasn't, as much as she was like, I guess, trying to bring people like therapists in to help him with his speech and like his interactions and just therapy in general. She couldn't provide in our area that we lived in, couldn't provide for him what he needed. So overall, it's been a good switch for him, but it's definitely hard to like not be able to see him all the time. I only get to see him once every couple months. So, like, but I could see like the toll it would take on her as well because she was trying to work and do school and other things, but that's just, you know, priorities being out of line. So it's definitely kind of taken a toll on everyone, but it's not his fault.
Yeah. Even the elderly people, right? If they have some kind of stroke or major surgery, a major accident, and so forth, right? There is burden. Yes.
My stepson was in a motorcycle accident. Yeah, stepson.
Okay.
And it's like 4 years ago, and there's still so much anger and disappointment, you know, et cetera, et cetera. Like it happened just yesterday. And it'd be nice if they did the meditation, you know, like live present. So I suggest it is very burdensome for all of the family.
I know a man. He passed away a couple of years ago in California. He had a stroke when he was about 69 years old. But he's a man, one who runs his own business. He has employees, he has great business. Probably that $1 million business. And he's the main one. But when he had a stroke, his wife saw out everything. Because she couldn't handle that kind of business. And he was basically in coma for more than 3 years. And they put him in the nursing home at home. She could not handle him. So every day, almost every day, she went to take care to the hospital, to the nursing home to take care of him for more than 3 years. For us, for outsiders, it's a burden. Of course, because of her love, right? Who knows, right? When I don't know, you need to take care of your spouse, your children, or your loved one, right? So that shows that your dedication, that shows your love when they have the kind of problems, when they lie down there without no anything else. And this requires a lot of strength and effort, plus the mindfulness too. But the baseline is the love to take care of them. Without love, you know, all of you visit nursing home already, right? So you see many elderly people or chronic ill people are put in the nursing home without the care of their own family members. It's really frustrating, and especially the older we are, the more we like to have the love from our family members. Yeah, here we have good healthcare system, right? The doctor, the nurses can take care of health, but on the top of that, love is so important to keep us alive. We'll talk more about that. Okay, number 4, please. Yes, how to deal with the drift. Yes.
The article I read was talking, it was showing how mindfulness is kind of the inverse of the grieving process. And we talked about a lot of the aspects of mindfulness, mainly like paying attention on purpose is how they put it. With curiosity and inquisitiveness. And when we're grieving, we don't like to pay attention to the pain of what we're going through. It's one of those things that we like to push aside. And it talked about coming back to the now and not longing for the past or the future. So not longing for how it used to be or hoping that it'll get better in the future, just accepting how it is. And then paying attention to experiences without judging them, like we talked about. Being emotionally non-reactive and accepting that pleasure and pain are equal. And so realizing that the pain that you're going through isn't worse than the times that were good. It's just something that you have to go through. And to allow yourself to feel whatever you feel and be okay with that. And one of the myths about the grieving process is that if you keep busy, it'll speed up the healing process. If you just stay busy and keep your mind off of it, you'll heal. But the author of the article was saying that that's searching for permanence in an impermanent world, and it's pointless. She also said that time and energy are used running after temporary pleasures, and trying to tame suffering only makes it stronger whenever you have to experience it because you can't avoid it. And that there's no solution to grief because grief's not a problem. It's a normal part of our experiences as humans. And trying to run from grief is pointless because it will always return, whether it's emotional, psychological, or physical. And we must not ignore the pain of grieving because they put it as like we'll be stuck in the illusion of its permanence. So when you accept that you're grieving, you'll accept it's just temporary. But if you keep pushing it away, that's when it comes back. And we have to come to terms with the reality of how things are, and by accepting that this is reality and this is unavoidable, then that's what will heal, and that's what will speed up the process.
And you have some experience about losing some of your family members before. The close one, how you feel at that time? It's not easy to handle, right?
I've never dealt with grief for someone who actually passed away. Like, I've had family members who passed away, but I was never close with many of my family members. So when they did, it kind of felt like it was somebody I didn't really know passing away. But I feel grief about my mom a lot because she acts like she's a lot older than she is, and because of like all of the medication she takes, like she'll get up out of bed. Recently she was doing this a lot. She would fall like 1 or 2 times a night and just start like screaming for my dad to come get her. And it's like it's really scary, and it feels like you just always think like something's gonna happen to her. So you feel grief like you've already lost her, like because she's not there all the time. And then my dad had to go to a doctor with her to get her off some medications, and like now she's better. But like it's like kind of like been a cycle like that for a very, very long time. Where, like she'll get off of it, and then she'll go to her doctor and be like, no, I want more medication, and then it'll happen again. And she'll just like play catch, fall.
Any one of you experience about gift and can we handle or when some of your family members? Yes.
Last year, my grandma passed away, and we were really close. I'm like the oldest, so she babied me my whole life.
Oh, really? Okay.
But I don't. Even now, it's hard to talk about. Like actually, just last night, someone like brought it up, and I almost started crying. But,
yeah. Okay. Yes. Yeah. It's just not easy when someone that's close to us, that's so lovely, and they won't be here anymore. It's not easy. So this is the mindfulness and grief. You read this one or other one?
Yeah.
You did? Okay. The mustard seed. You know this story? You know this story? No? Okay, the story says this lady, her little boys died, and she tried to find someone that can bring her back, bring her back his life. So someone told her, okay, bring him to the Buddha. He has second power. He could bring your child back to life. So she brought him to the Buddha, and the Buddha said, well, okay, if you go to the village and find the mustard seed from any families that doesn't have anyone pass away, and bring that mustard seed and can bring back your child life. And so she carried him around and knocked the door of the people asked for this mustard seed. And no, there's no one. No one could. No families does not have someone that's passed away. That finally she could not find the mustard seed. So when she brought him back to the Buddha, we say, and she recognized us, and she let go of the child and became a nun later on. So that's the story. Mustard seed here, very famous story. Yeah. Okay, let me keep busy. Keep this busy. Let me they recommend what called sharp points. How to sharpen the pen and give. So in the West, we associate give and pen is something wrong about. In Buddhist tradition, it's normal. Every year, I do at least 1 or 2 funeral service for people. And last couple of weeks ago, I don't know whether I told you or not, I just did the funeral service for a old man. And yeah, when you were in that kind of situation, you could feel the suffering of the family members. It's not easy because they live with you. They live with them for many years, many decades, and now suddenly they be gone. If they are the main support of the families, this is probably total disaster, right? Or sometimes even the elderly people, right? That you love them too much, sometimes sooner or later they have to go, but it's not easy to let go. It's not easy to accept that reality. That's why at the beginning I asked in class, do you accept that one day you will go forever? You'll be gone forever? You accept that? If you're not really to accept that, and you may not accept whoever, your spouse, your children, your parents, or his parents. The one couple who live in Atlantic City, New Jersey, they have 2 children, 2 grown-up children. One is boys and one is girl. Both of them are in college. And one day, their boys, their son, somehow pass away at the age of mid-20s. That's a big shock for them. They have hopes. They have the plans for his future. They reach, and that's a big shock for them. And even now, it's been for more than a year, almost. I don't know where every day, but every week they go to cemetery to visit him. It's not easy to let go, right? So with this kind of understanding, mindfulness or acceptance, that's a process of life. No one can live forever, whoever we are. If we recognize us, we still remember them, but somehow it's just painful. It's okay, we can talk more about that later on. Let's go on number 5 here. Yes, what's your number 5?
Number 5.
Yes.
I find an article called sometimes like we've seen like about mindfulness, like taking care of people, and they're talking about like whenever like you live with elderly people, like we're talking about like maybe Asian culture or people live in like South America. And sometimes like it's difficult to taking care of them is because the mood like for elderly people usually is not very stable. Their mood like always change. Maybe sometimes because they don't sleep enough, like they have very short time of sleep, or sometimes, like they have like disagreement about like the point of view about life, like between the young people, like talking about like in their life, like in their generation, they expect about like, okay, look like if you're a girl, you have to stay at home, like you shouldn't go out with anybody after 9 o'clock. But now, this generation, we believe about we have freedom, we can do what we want, even if as our parents, like they still like want freedom. But when we live together with elderly people, they always like complaining about what we should do and what we shouldn't do. So it's kind of like block us about the communicate between each other. So we sometimes like we misunderstood because like usually like our parents like go to work a lot and they feel really overwhelmed about like work and everything around. And also when at home they have to face with like elderly people and include sometimes with like their sickness or their illness, we make them feel even more stressful. So they talk about like how mindfulness can like do the same like through state to let you aware about the present moment. Like you should like focus about, okay, now I go home, I take care of my family, my parents. I should not like get my anger or blame on anything on them because the external anger, like you carry from work or from school or from somebody else, and that's how let you aware about the like accepting about why elderly people have a different point of view with you. So like the more mindfulness, like on both sides, the caregiver and elderly people, like you can do like meditation and you really calm your mind and you accept it like both sides of generations, so that is work out better instead of you ignore about look like talking about yes, sometimes the older generation, they really harsh and they have their own rule, but it doesn't mean that it's a bad thing. Like actually talking about like learn from each other, like both sides. So that's how we can stay stable and more peaceful.
Based on the thought that for the elderly people, they're getting older, right? What you call the aging process, right? They may be tired easily. Their vision, their hearing has problems so far, and they may have some aging pain in their body. So that's the reason that it's easy to aggravate, irritate them. That's why they comment. If we understand that situation, and we want to have that kind of symptom too, right? If with that kind of understanding, mindfully, we would try to not to please them, we try to work with them to help them out.
I have an example too because I remember when I think in 1997, I think like before I go to first grade, and my grandma had a meeting, and she couldn't work. She just like, like the only way she could do is like just sit up. So my mom have to handle business and also have to take care of me. My dad have to go to work, and our business really busy. And like sometimes, because my grandma, she couldn't go to, like restaurant very easy by herself. So my mom, sometimes, she just, like wake up, sometimes like she just, pee on the bed. So sometimes my mom, like really, even if my mom really, really loves, her parents, but sometimes it's so difficult for you at the moment. You have to like handle, like, okay, I have to go to take care of my mom now. At the same time, you have the customer come in at the same time, so you don't even know which one you take care of first at the same time. So at that time, I get influenced. My mom get pissed off at me. She get really angry. Even if I didn't know that, I just like sit right there, because I was so little. I came up like clean up the mess with my grandma. But my mom would just like get angry at me. She'd say, "Why don't you try to find something to do? Why don't you have me?" So it's really difficult, even if you really love somebody, because it's really difficult taking care of somebody like you, even if you are young parents.
Yeah, that's what we call burnout, right? Physical burnout, mental burnout, and emotional burnout. Yeah, so that's right. Okay, let's start with number 6. Yes, please.
So the articles I read were really pretty good about talking about how to help somebody cope with dying. It wasn't just elderly people, but I left off, my notes are on my phone, and I accidentally left it in my car, but I remember most of it. So one of the things that it recommends you do is to respect the person's beliefs. Their beliefs might be different than your beliefs, but when they're dying, their beliefs are the most important thing to recognize at that time. So you should recognize and honor and respect their beliefs, because those are, our beliefs are a comfort to us. And so the person who's dying, their beliefs should be respected. It's not a time to try to, influence their beliefs or, convert them or whatever. You should just respect their beliefs, because that's where they find their peace and their solace. Mindfulness helps us to have empathy and to, have compassion and understanding, and to be able to sit and wait and be patient, because dying's not normally a fast process. I mean, if you're in an accident or you have a stroke or something, it might be fast, but if you die of, a disease or even a natural cause, sometimes it can take a while. It's not a quick thing. So it's good to practice mindfulness if you're sitting with someone who's dying, because it can take time, and it can be kind of emotionally difficult and physically draining as well. So it helps with to have empathy so that you can be patient. It's good to be, mindfulness helps you to be in the moment, and if the person's speaking to you, to be able to listen to what they're really saying, and to it's said to use good words. So when you're talking with someone, to be reassuring. One of the main, and now this wasn't in the slides, but when my mother was passing away, and I sat with her almost 3 days, because it was the active dying process took about 3 days. There's passive dying, which takes a couple weeks, and then you switch into active dying, which takes anywhere from 2 to 7 days, it just depends. And those research I was doing while I was sitting with her, because I had never been around somebody who died, but I was taking the Buddhism class at the time, which was extremely helpful. Because it helped me to meditate, and like her and I didn't necessarily share all the same beliefs, but at that time I was able to like honor her beliefs, and like some of the things we did when it was just me and her, and she was pretty much in a coma or in and out of consciousness. I don't know if she was in a coma, but she would come to and then be away. But they said that the last thing that goes is hearing. So even after a person's clinically dead, they might still be able to hear even for a couple of minutes. So that, like what you say, how you interact, and the things you do are really important when you're spending time with a person. So it's being mindful in that situation is especially good. So what we would do is, like I would just sing songs that she likes. They were more religious than my personal beliefs, but I knew that they meant something to her. So I knew it would comfort her.
So like we sang, and I say we, but it was me. My brothers came too, and we all sang in like a group, and like we prayed with her, and just sat around and talked about good times, you know. And they said one of the things that that's really good for people who are passing is to let them know that it's okay that they leave, because some people might be afraid to leave, thinking they have something they have to do still. And if you like reassure the person who's dying that their wisdom and their knowledge and your memories of what they've taught you are with you, so that they're still with you, and that you're not going to forget all the things you learned, that reassures them. They feel like you're going to be okay, and that what they've taught you will remain, that helps them to just have peace when they pass. So that's good. I also lost, before I lost my mom, I lost my grandmother, 8 years ago, and then my grandfather, and I was very, very close with them, even probably a little more so than my mom. My mom was my stepmom. We always had a challenging type of relationship. We loved each other, but it was challenging. But like my grandparents were like my special place, you know. So I understand how Morgan feels, because that was a really big challenge for me to deal. And even still, I'll get a moment where just a song or something will, a smell, a memory, a really strong memory will kick in, and it's hard. I'll just start crying, you know, out of the blue. But with the Buddhism and then this class, I've learned that, you know, just accept that feeling, understand you feel sad. It's okay to cry, and then just move on, because it's temporary. You're not going to feel like that every second the rest of your life. Those times will come and then they'll go. So I think that knowing like things that they taught me that I still do, that those are good feelings that come, you know. So I mean, there's things that you keep the wisdom of the people who passed, and that helps you to create.
So you sat with her
sat
before she passed away. You witnessed that process.
Yes.
So you witnessed her last breath.
Yes.
How many of you have witnessed that?
Yeah.
Right. It's scary, or what? What do you think?
I don't know. I thought it was peaceful.
Peaceful.
Yeah, it was a little mix. It wasn't even my grandma I was with. So when I was dating, we've been together a while, and like I was really close with the family, so I was there too. And so I had mixed feelings, because I loved her, but she wasn't my grandma per se. So we weren't at home, so like it was a little less peaceful than I think they wanted as a family, but it was good for them all to be there.
About others, have you?
Not a person, an animal, but
okay.
It's not the same, but it makes me feel a little bit anxious to be there if it was a person, because it was painful for an animal. So I know it would be really painful as a person. So I think it actually kind of makes it worse than I did before.
For me, I have one experience about the man. He's in his 50s. He has lung cancer. He passed away in a challenging way. His throat, I think, has a blister. So it's very hard for him even to breathe. When the air, you know, when you have a cough, right? When the air come out, in and out of your throat, it's like a sharp knife to cut your throat. And he struggled really last few hours before he passed away. And as a monk, I did the ceremony, the prayer for him. So I set up, let's say, a small room. So his bed is here, and I set up the altar over there. And so I prayed for him, but somehow I could hear his body is his body around, because it's so painful for him to stay at peace. And he tried to cry out too, but it's so painful. And I prayed for him more than a day. And this is part of religious traditions, our Buddhist tradition. And I told his wife to release the animals. That's our traditions. in our belief, you can say that our Buddhists believe that somehow in the past you create some kind of bad karma with living beings. So when you release the animals like the bird, the turtle, and so forth, you would overcome or compensate that kind of karma. So I asked at that time he didn't ask the leader. I know how to do the prayer for him, but at least I could do things for him, like asking his wife to release the crabs. They live in savannah. So in a couple hours he passed away. And that's just one of the first wisdoms that I ever have, to recognize, to see things, to see people passing away or dying. And this is not easy when you absorb or witness that kind of situation, right? It's involved a lot of emotions. So I used to give an analogy like you put a leaf on the water of the river, it will flow. It will flow. It won't stop at that moment. The moment that you drop down the leaf onto the river, you understand that? When you drop down that leaf, it will flow. So again, life is temporary. So if we accept that, we can move on. Otherwise, it's not easy. Especially, sometimes you heard some story, especially the couples, if they live so many years together, if one pass away, another one may go in short periods of time. You know why? The affection, the love. Right? And even when we talk about last time too, right? That's they depend each other, right? The wives expect the husband need to take care of renovate the house or fixing the car and so forth, and the husband expect the wife to take care of the kitchen, right? The food and so forth. But when the party pass away, they total loss. So you need to be ready, even this, some of you still young, but you have to be ready for that type of stuff. Of situations. This is the reality of life. Okay, so you're the last one, please. It's similar to here. Yeah, please.
Okay.
Yeah, go ahead.
So, mindfulness in dealing with elderly patients. The article I read talked about MBSR and how it's used, and it focused on the caregivers. The focus is on intention, attention, and attitude are key. And that reminded me of my aunt. Whenever my uncle passed away from cancer, she always said that she could deal with anything except for a bad attitude, and she stood by his side the whole time. She always had a really great attitude about it, and it really made a huge difference in everyone's perspective on his death. Whenever he died, it was just a lot easier for a lot of people knowing that she was going to be there and she was taking care of it, and she had a great attitude. They focus. Okay, so intention as in a personal goal or vision or self-exploration. Attention to the present, internal and external experiences, and attitude of equanimity and acceptance. So dimensions of accepting successful or healthy aging, self-acceptance, personal growth, purpose in life, positive relations with others, and environmental mastery and autonomy. So another thing that a lot of people have talked about is elderly people tend to reject being old or aging. So MBSR really helps with that, and teaching acceptance and providing people with tools and how to, if you're a caregiver, how to help people who are not accepting aging, because if you have a bad attitude about it and you're trying to help somebody, you might be pushy. You might not accept that they're not accepting something, and the way to speak to them that will encourage them makes a huge difference. And then also for the patient, how to accept it. There's a great quote that I read: "Death is like a mirror in which the true meaning of life is reflected." So when you think about death, and like for me, when I think about death, I tell myself that if I could speak to myself while I was still alive, my dead self could speak to my live self. And my dead self would tell my live self not to think about death because you're alive. And that would be a waste of time, just to enjoy what time you do have here. That's the way I look at it. And then there's other things like in the article, there's studies on elderly people dealing with chronic pain and how mindfulness-based interventions help focus and reconnect the mind and body around the theme of acceptance. And they have particular therapeutic value for older adults because physical symptoms, deteriorating biological systems, chronic disease, suffering is inevitable, but suffering obviously increases if you don't accept that it's inevitable. Yeah. And then there's a big thing on the Presence Project. It's a project that helps elderly people. It's a holistic approach to dealing with death, dealing with old age, and becoming more healthy, or as healthy as you can be.
So somehow in the West, even in modern times, somehow we don't like to talk about death. We don't want to talk about dying or getting old and so forth, right? But that's the reality of life. In Buddhist view, this is a process of life. We come here, and one day we go, we be gone. And like you just mentioned, right? The things that remain with you is the way. The things that she taught you and so forth, right? So you reassure that things belong to her still within you. So that's Buddhist idea too. So that is not the end of life in Buddhist view. It's a cycle. Yeah, whether you believe or not, it's up to you. But this is in our belief. So one day, they maybe come back in different forms. This is the hope there. All right. Anyway, so I like any question. So again, this kind of topics maybe educational for us, right? So whether we have experience yet, but still we need to deal with this kind of reality of life. And big point is acceptance, right? Accept the reality of life. Let me show you some video clips before we depart today. Let me see. This is burden, a short one.
This program is brought to you by Emory University.
Mindfulness practices can help family caregivers who are really stressed by giving them a tool to gain control of their lives that seem really, really out of control. They are burning the candle at both ends. They are constantly meeting the needs of their loved one who needs them. And so by using these practices and helping them to integrate mindfulness into their everyday life, they can actually return to a place of being more centered, being more in control, being more accepting. Instead of resisting what's happening to them, which is something they really don't like, they can actually be more open to it. And in doing that, they actually aren't so stressed. Well, I did a study, and it was a pilot study, looking at how people with early dementia, so like early Alzheimer's disease, when it's just beginning, when it's just first diagnosed. And so people with early dementia and their loved ones, and teaching them to incorporate mindfulness and compassion-based practices in their lives. And so we looked at people, we had them first do mindfulness practices, and then we evaluated how helpful they were, and got feedback from them, and we looked at attention measures, we looked at quality of life kinds of measures, and we did the same thing with something called a loving kindness practice, which is a compassion practice, and then another kind of compassion practice. And essentially, what we found, we learned a lot in this study. And one thing that we learned is that the loved ones, the caregivers, family caregivers are very stressed, and they benefited most. And that the people with early dementia had a little bit more trouble doing the practices, because they felt like when they were encouraged to listen to a meditation CD for 15 minutes, they felt like they couldn't understand why they were doing that. Even though they were reminded why they were doing that, even though they had big cards that said why they're doing it, they still felt like they were wasting their time. And so they didn't get as much out of it, but the family caregivers got a lot out of it.
Some video clip here. Set of home caregiver guys, a lot of things. Okay, let's move on to the next one. The next one we talk about addiction. Now here, if you can, provide some mindfulness-based model, okay, for alcohol use, eating disorder, smoking, drug abuse, and so forth. Okay, so at night. Okay, please. Number one. Okay. Yes, number two, please. Okay. Three. Okay. Jessica, right? Jessica.
Yeah, Jessica.
4, please. Okay, Rebecca. 5. 6. 6. Okay. 7. Yes. And 8. Last one, you're the last one. Check. Okay. Okay. Can you give me one more minute? Second. So you do presentation and hearing, right? You do presentation, right? Right? Okay. We have only one more presentation, so that we can cover the times. So the rest of you have the topic for final paper. You need to ready. All right. Thank you.
Good writing one is really short. I can't write long things. Stand up to go wherever, but no, it's not. Yeah. I can't decide though.